Today at the State House, representatives came out with legislation to combat the opioid crisis. This follows proposals by the state Senate and Governor Baker. The House measure would put new limits on the prescription of highly addictive painkillers. There would also have to be evaluations at emergency rooms for people with overdoses.
Our goal with this legislation is to create a safety net, a new standard in acute care settings, a new best practice designed to ensure the proper assessment and discharge of patients who seek voluntary treatment. And I am confident that our plan is a balanced, pragmatic approach to addressing patient care and ensures that our most vulnerable population has the access to treatment they need.
About 1/4 of the beds in these emergency wards are taken up by those with substance and mental health abuse. So if we're talking about keeping these folks in the emergency ward for 3 days, I don't see how a hospital is going to be able to either care for them or, for that matter, care for those who have some other physical ailment that are there in the emergency ward.
You have to look at the fact that when people are using, if they don't have some sort of intervention, left to their own devices, people will use again, to feed their addiction. And so if you're holding them and you're treating them, that's a good thing. But as the speaker mentioned, that might be constitutionally not the way to go. As I say, the flip side is if you let them go, the chances that they're going to use again are pretty high.
And we know that only 13% of the people in Massachusetts with substance abuse disorder receive that treatment that could be helping them from relapsing and returning to the hospital. So we need to make sure that we identify patients in the ED, evaluate them, and get them to the appropriate treatment so that we can continue towards another step in improving everyone's health outcomes here in the Commonwealth.
It's our belief that this bill will slow down Section 35s because folks will be able to get assessments through the emergency rooms and assistance with placement, opposed to having to go through the criminal justice system and go through the courts to get a Section 35 as a way into treatment. So we think that more folks will voluntarily enter treatment opposed to using the criminal justice system.